Title: Chronic Myelogenous Leukemia. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale. Message them on Instagram at CoffeeFirstCup to receive generous discount codes. Introduction. Chronic myelogenous leukemia, CML, is characterized by a chromosomal abnormality involving a balanced translocation between chromosomes 9 and 22, known as the Philadelphia chromosome. This translocation results in the formation of the BCR-ABL fusion oncoprotein, driving the pathogenesis of CML. The management of CML has undergone significant evolution, particularly with the advent of tyrosine kinase inhibitors, TKIs, targeting the BCR-ABL protein. This overview explores the molecular basis of CML, current therapeutic approaches, and the efficacy of TKIs in achieving hematologic and cytogenetic responses. Chronic myelogenous leukemia, CML, originates from a hematopoietic stem cell with chromosomal aberrations, notably a balanced translocation between chromosomes 9 and 22, known as T922, observed in 95% of cases. This translocation leads to continuous production of the BCR-ABL fusion oncoprotein, weighing 210 kDa. Clinical manifestations and disease progression correlate with the white blood cell count and its rate of elevation. Treatment is typically recommended for patients with white cell counts exceeding 50,000/μl. Imatinib, a tyrosine kinase inhibitor, TKI, has long been established as the primary first-line therapy for previously untreated patients with chronic phase (CP) CML. The majority of patients treated with imatinib achieve complete hematologic response, with 40–50% achieving complete cytogenetic response. Imatinib is generally well tolerated, with minor adverse effects. Dasatinib and nilotinib were initially approved for patients intolerant or resistant to imatinib and are now also indicated as first-line treatments for CP-CML. Bosutinib and ponatinib are reserved for refractory disease, with ponatinib effective against various BCR-ABL mutations, including the T315I gatekeeper mutation. Asciminib, the newest kinase inhibitor, is approved for Philadelphia chromosome-positive, PH+, CP-CML previously treated with 2 or more TKIs and for PH+ CP-CML with the T315I mutation. Conclusion. In conclusion, chronic myelogenous leukemia, CML, represents a paradigmatic shift in oncology, wherein targeted therapies such as tyrosine kinase inhibitors, TKIs, have revolutionized treatment outcomes. The hallmark translocation of the Philadelphia chromosome, leading to the aberrant BCR-ABL fusion protein, underscores the molecular underpinnings of CML. TKIs, particularly imatinib, dasatinib, nilotinib, and ponatinib, have demonstrated remarkable efficacy in inducing hematologic and cytogenetic responses, thereby prolonging survival and improving quality of life for patients with CML. The emergence of novel agents like asciminib further expands treatment options, particularly for refractory disease and those harboring the T315I mutation. Moving forward, continued research into targeted therapies and combination approaches promises further advancements in the management of CML, with the ultimate goal of achieving durable remission and enhancing patient outcomes. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video.